Acute aortic dissection is a rare but potentially life-threatening and time-critical medical condition. So raising awareness and educating the general population about aortic dissection is important for early diagnosis and improving the chances of survival. Hi, I'm Dr. Lakshmi and you're watching the Health Talk session by Yashoda Hospital. So let's discuss and know more about acute aortic dissection, and joining our discussion today is Dr. Vikram Reddy, Senior Cardiothoracic Surgeon from Yashoda Hospital's High-Tech City. Welcome to the program, Doctor.
Hello.
So let's begin with the basic question, Doctor. We all know what heart is and the important function it does every day. So could you explain to us what aorta is?
Aorta is a main blood vessel which comes out of the heart, and this gives out branches and supplies oxygenated blood supply to all the organs, to heart, brain, liver and kidneys, everywhere. So there are diseases which can affect the aorta.
So doctor, what are the various disease conditions that could potentially affect the aorta?
If you see the anatomy of the aorta, it has got 3 layers, the outer, middle and inner layers. So disease affecting the aorta can cause either the aneurysm or the bulging of the aorta, or the tear in the aorta, which is called the aortic dissection. So these are the main diseases which affect the aorta.
So aortic dissection can be a catastrophic event with high mortality. So can you brief us what aortic dissection is, doctor?
When I say there's a aortic dissection, it tells us that there is an intimal tear, which is a tear in the inner layer of the aorta, leading to blood rushing within the layers of the aorta, forming a false lumen. This tear can move forward, ripping off the branches which supplies the various organs, and it can propagate down until the legs. So this leads to formation of true lumen and the false lumen. And aortic dissection is a lethal condition, and which needs an emergency attention.
So what are the risk factors which are associated with this potentially life-threatening condition, doctor?
There are various risk factors. Hypertension or the high blood pressure is one of the major risk factors which can be seen in 70% of the patients who have this aortic dissection. Deento paatu atherosclerosis, genetic disorders like Marfan syndrome or Turner syndrome, or కొంత పేషెంట్స్కి bicuspid valve ఉండే అవకాశాలు ఉంటాయి. వాళ్ళకి there is a high risk of aortic dissection. And sudden lifting of heavy weights, as we see in gym, and of late we hear in social media that famous celebrities are dying of sudden cardiac death. So these could be because of aortic dissection and rupture of the aorta. And sometimes it can be due to trauma, or rarely during pregnancy when the patients have high blood pressures during pregnancy.
So I'm sure aortic dissection gets diagnosed without any warning signs. But do you think, are there any warning signs that we should know before the actual emergency event happens?
Yes, exactly. So these patients, they present all of a sudden. The symptoms almost mimic symptoms of heart attack. So అందరు హార్ట్ అటాక్ వచ్చిన పేషెంట్స్ లాగానే వీళ్ళకి కూడా సడన్ చెస్ట్ పెయిన్, బట్ అయోటిక్ డైసెక్షన్లో ఉన్న వాళ్ళకి దేర్ ఇస్ అ డిఫరెన్స్ వేర్ బ్యాక్ పెయిన్ కూడా చాలా సివియర్గా ఉంటుంది. దాంతోపాటు బ్రీదింగ్ డిఫికల్టీ అండ్ గిడినెస్, సడన్గా లాస్ ఆఫ్ కాన్షియస్నెస్, ఆర్ ఒక్కోసారి ఆర్గన్కి బ్లడ్ సప్లై స్టాప్ అయిపోయి దే కెన్ ప్రజెంట్ విత్ బ్రెయిన్ స్ట్రోక్ ఆర్ లింబ్ ఇస్కీమియా.
So doctor, once a patient presents to you with these symptoms, I think it's interesting to know how this condition is diagnosed and what are the tests that you usually run.
Yeah, once this patient is he presents to the hospital with these complaints, the usual they do is the chest X-ray, which usually it fails to diagnose, but the echocardiogram done emergency low. With a fairly experienced physician, they can diagnose the dissection, especially the type A dissection. So initial echocardiogram, most of the times type A dissection lo bayatapadutundi. And the other investigations which usually require the confirmative is a CT aortogram, which is a definitive diagnosis for aortic dissection.
So once diagnosed, doctor, how do they get fixed in short term and how does their long-term plan look like?
So once diagnosis is made, we have to clarify whether the patient has type A dissection or type B dissection. So if the patient has type A dissection, this patient needs emergency surgery. So in what we like surgeons we describe is the patient should not see sunrise or sunset. So these patients with type A dissection, they have a very high risk of sudden death, rupture, or heart attacks or brain strokes. So these patients need to be taken to emergency theater as soon as possible. Whereas the type B dissection, these patients either can be managed medically or these days newer technologies have come where you put a stent to prevent the risk of rupture and prevent the risk of expansion of the aneurysm.
So what is the risk of future aortic dissection, doctor, especially if patients get operated for this? Is there a risk of developing it again?
ఇది మంచి క్వశ్చన్ యాక్చువల్గా టైప్ ఏ డైసెక్షన్ వన్స్ ద పేషెంట్ హ్యాస్ టైప్ ఏ డైసెక్షన్ దిస్ పేషెంట్ ఆల్రెడీ హ్యాస్ ది డైసెక్టెడ్ పార్ట్ ఎస్పెషల్లీ ఇన్ పేషెంట్స్ ఇఫ్ ద డైసెక్షన్ tear is propagated down towards leg. So these patients you only repair as a stage 1, replace the first part of the aorta along with the artery supplying the brain. So these patients they continue to be monitored because the rest of the aorta is already torn and dissected. So that needs to be carefully followed with a regular CT scan every 6 months or 1 year. But the other patient in type B dissection where you manage medically or even if you do a hybrid procedure or the latest endovascular stenting, these patients, they can continue to have problems and the aorta can expand and which needs to be intervened either surgically or through hybrid procedure at a later date.
So especially after surgery, doctor, what do patients need to know about monitoring and lifetime care, doctor?
Yes, there is a lifelong plan for these patients. They need to be monitored closely under physician or surgeon follow-up. They need to control their blood pressures and they need to avoid high-intensity sports or heavy weightlifting. And they need to be on proper medication and regularly checked. And a regular CT scan. Initially, after dissection, we do CT scan every 6 months for 2 years. And if there is no change or no expansion, we do it every year. And based on that, further plan can be charted out for them.
So are there any lifestyle modifications that patients need to make, doctor?
To prevent aortic dissection especially in patients who are long-standing hypertensive or in patient or an individual who has a family history of aortic dissection, or there are other risk factors like genetic Marfan's or patients who have bicuspid aortic valve. These patients, they need to be really careful when they go to gym. They should avoid high-intensity sports or sudden lifting of heavy weights, and they need to properly modify their lifestyle to control their blood pressures.
So discussing about aortic dissection, doctor, we've discussed about various investigations that we run through. But is there any role of genetic testing, doctor?
Yes, some of the connective tissue disorders like Marfan syndrome, Ehlers-Danlos syndrome or Turner syndrome, they have genetic predisposition for aortic dissection. So in individuals who are Marfan's, there are genetic testing which can be done to identify the chromosomal abnormality. So these patients, especially the female patients who are Marfan's, they need proper counseling before they get pregnant, and they can get in vitro fertilization to avoid the induced ovulation and in vitro fertilization to avoid transmission of Marfan's onto their kids. So they can be done, and once diagnosed, they need to be closely followed up to prevent the grievous complications coming from the aortic dissection.
I'm sure most of the patients and their family members have to deal with a lot of anxiety, fear, and post-traumatic stress disorder. So how would you like to address this issue, doctor?
Yeah, exactly. Yeah, they suffer from a lot of post-traumatic stress disorder. Why this happened to me? So why me? So they need proper counseling along with their wife, children, or brothers, siblings, everyone. We need to really properly counsel them, and we have to tell them that once treated, they can lead a normal life, except not doing these high-intensity sport. But that's okay. They can continue to have a regular walking, brisk walk. Everything can be done. We always counsel them to lead a normal life and focus on the treating the control of blood pressures, diabetes, and reducing the anxiety levels. So the family also, they need counseling, which is usually done, and they are okay with it.
So before we conclude, what message you would like to tell to our audience as far as aortic dissection is concerned, doctor?
So aortic dissection is more or less is preventable in most of the cases. So my suggestion is control your blood pressures, control your cholesterol levels, reduce the anxiety. Please, when you hit the gym, see a doctor above 40 years. See a doctor, please, before you lift heavy weights and do high-intense sports. And once diagnosed, or you can always be on a regular checkup with one of the cardiologists or a cardiac surgeon, and that too at a hospital where all the facilities are available and a proper diagnostic equipment is available and proper therapeutic advanced treatment is available.
So this brings us to the end of this episode. Remember, having knowledge about your health is crucial for your overall well-being, and we at Yashoda Hospitals are more than happy to answer your health-related queries. And don't forget to tune in for next week as well. Until then, take care and stay healthy. Thank you.
Thank you.